Hi, Dan. It's good to see you. Hi, Monica. Thank you for joining me. All right. Tonight, we are talking about common mistakes that new medical coders make in coding. I'm also going to address a couple of questions that came in, and we're going to start with those before we dive into the show, as I told the people that I would address that. So let me get them pulled up here. I hope y'all had a great day. It is Thursday, the 28th. And where did October go? This month went by super fast. Super fast. All right. Okay, got the questions up. All right. Gonna wait for a few people to come in. More people. All right. Is everybody ready for Halloween? It doesn't even feel like Halloween, although you would never know it today because it was very windy. I mean, like very fast winds, like 24-mile-an-hour gusts. It's crazy. All right. Okay, so we're going to go ahead and get into it because we're already at 7:34. So if you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Tonight we are talking about some of the common mistakes that brand new medical coders make and how to avoid those mistakes. I am also going to be addressing a couple of questions that came in from some folks. I'm going to address those first so we can just get those out of the way before we dive into the subject. So, because a promise is a promise. And the first one was, how long should I take to study? How long should it take to finish anatomy and physiology class? I'm trying to figure out a timeline and want to make sure I'm staying on pace. I'm doing individual classes instead of the bundle course, so I know I have more time, but I'm wanting to know what is the average length that should be spent on each class. So when you're looking at like the classes, and I don't know what class bundle she's working with, whether it's with AAPC or AHEMA, or even if it's with one of them at all. I would just look at however many classes that you do have and the amount of time that you are supposed to finish those classes. Even though you may be paying for a class at a time, it still doesn't hurt to kind of go by, a timeline for that. Typically with anatomy and physiology, it's 2 months. But again, depending on your program and depending on what they're teaching and how many courses there are, you'd have to go through that. You'd have to be able to break it down that way. There is really no one size fits all when it comes to that, because even though you get through that course, you can get through it, just as quick as you want, but you can still refer back to that course. So I would say, on the outside, 8 weeks, 2 months. So it's entirely up to you on that one. And the other question was, hi Blue, as a 16-year medical assistant, I'm studying for the CPC. I only have minor coding experience, but much medical terminology and some billing. But I'm more clinical. Will this give me an advantage in finding a coding job? Because I've never had an actual coding job before. I hear any medical experience helps, but coding has a life of its own, so I'm stressing. I'm not looking for more pay, just any coding job. Thank you. So when it comes to people who have been in the medical field, and whether they are medical assistants or nurses and things like that, and they say, well, I have done some coding. Okay, so for that, that's not technically what you're doing. It's not technically coding. You may be selecting diagnosis codes, you may be selecting procedure codes, or evaluation in management levels, like on a form or something like that, even though it's a doctor that's doing that. But sometimes when they say that they do it and the doctor just checks it, they think that that is coding, and that's not actually coding. What that is you're just selecting from a pre-done list or something like that. Coding is actually looking at documentation, reasoning it out, abstracting or getting the diagnosis out and getting those levels out, getting the procedures out, as far as like finding them, identifying them, getting the codes for them. So technically what nurses have done and medical assistants and CNAs, LVNs, if they've assisted with any of those like diagnosis selection and procedures or whatever selection, that's not technically coding. That is just selecting a code. To be a medical coder and to say that you've done coding is when you actually take the documentation, look at it yourself, and decide what codes need to be selected. Okay. Other than that, you're just selecting from a list. And that is what I would have to say about that. It's a common misconception. That is a huge misconception with nurses, because they think that they've done it. And I get that a lot. Well, I've done the coding. Oh, okay. So how do you get to this level? Well, no, we just select from a list. No. That's not coding. That is selecting. That is not coding. So there's a little bit of a difference there. Does it help that you've had this experience as a medical assistant? Sure. But you have to make sure that the things that you can say that you've done and the skills that you have, that you can transfer that over into being a medical coder. Somebody who's been a medical assistant, nurse, LVN, LPN, whatever, CNA, they have really good medical terminology and anatomy. That's great. Make sure that's on your resume, because somebody who is very familiar with that part it's going to be easier for you to read the documentation, because you're going to be able to understand it a lot better. And that's generally the theory anyway, right? So that would be what I would say to somebody who's coming in from the medical side, coming in over and going to be a medical coder. It does help, but it also takes you knowing how to market yourself in that way and saying, okay, well, I've had this experience and this is what I did. I worked with a lady. I did a resume review for her. She had been a professional massage therapist. So there was a lot of things that she knew already about the body. And she had worked with a particular clientele, and knowing that specialty, that was able to shine a very nice light on her in her resume, because she was very familiar with that process. And so that makes things a lot better for that person. And she was very successful now. She works a very good, nice job and everything. So that is something that you can think about. Wherever you're working as a specialty, and maybe that's the kind of specialty that you're thinking that you want to code in, something like that, you can talk up that you're very familiar with that particular specialty. That would be just my advice anyway. So I hope that helps. All right. Hi, Rochelle. Thank you for the blue hearts. Hi, Mitney. Doing great. Hi, Tangela. Hi, Rebecca. Thank you for the blue hearts. All right. So let's get into common mistakes that brand new medical coders make. One of the most common mistakes that new medical coders make is not knowing combination codes and not understanding how and when they apply. So that's the first thing out of the gate. So when I was brand new, I made the common mistake of coding hypertension by itself and chronic kidney disease by itself, not using the combination code. And so I got caught on an error, on an audit, it was an error. So I didn't know. And again, I was being self-taught, and somehow that part kind of slipped through the cracks. And so that would be the one thing that I would really suggest, is that you start learning about combination codes. For diabetics, they have a lot of combination codes. And there's looking in the book, and you'll see the word with under that header, right? So for diabetes, you'll see with. So when you see something like that, you're going to know that that is going to be a combination code. And it could be that they have, they mentioned foot ulcer. There you go. There's your combination code together. Pregnancy codes get kind of like, people get kind of nervous about that, right? because you have to have your main code, and then you got to have like the other codes that go with it. The book is going to guide you, right? It'll tell you use additional code, or code also. It'll give you those little words to kind of give you the idea. If you're using an encoder, it will go through the tree, the decision tree, and kind of help you that way. But if you get stuck with the encoder and you're brand new and it's kind of advanced, go with the book. The book will never let you down. Okay, if you're looking in there and you're like, okay, I can find the code, I can look up the code, I can look at the notes at the beginning of the chapter. That's something that a lot of new medical coders don't think about, is they look in the index, they go back to the tabular, and they look exactly at that code, but not at the beginning of the chapter. When you look at the beginning of the chapter, you'll usually see some kind of note. Now, of course, all publishers of these books are going to be different. If you've been with my channel a while, you know this is not an ad. I will say that first and foremost. Optum 360 coding. So at the beginning of the chapters, they have a lot of really wonderful notes. They other associations have their books. Okay, I have not seen AAPC book itself, so I wouldn't be able to tell you. But there are other publishers out there, like I said, they have their notes too. So you have to really look. But getting the right tools is what is going to help you. You can't really cheap out when it comes to getting these books. Now, I trust Optum 360. This is not even an ad, like I said. They don't pay me to talk about this, but this is what I use. These books are what I use. Books is what I trust. And when I see those notes have helped me. So always look at the beginning of the chapter when you're looking at that particular code. So if your code starts with, let's see, what is a good one? If your code starts with F45, right? So at the beginning, it'll, well, let me do another one, because, you know, YouTube gets kind of sensitive. Let's see, what is this? Nexa. Okay, I like this. All right. This should be a fairly good one. So we have the diseases of the eye and adnexa, and the range is from H00 to H59. So when you look up a code, then let's just say you're looking up, let's see, a citrical anthropen of the eyelid on the right. It's code on the right, it would be H02.011. And so if I need to look and see if there's any other notes that I need to be aware of, I go back to the beginning of that chapter where it says literally chapter 7, diseases of the eye and adnexa, code range H00 to H59. And I see there, and it says note, use external cause code following the code for the eye condition if applicable, to identify the cause of the eye condition. So if I had just jumped to the code itself and just coded it and went along my way, I wouldn't have known that there's a potential that I need to get the external cause code if there is an external cause code. That's what it means if applicable. If there's an external cause code that caused this eye condition, then I need to add that. And that's what that's saying. And that's that little note there. So these notes are throughout the whole chapter. It's not just where that range starts. It is at the beginning of the chapter. So always keep that in mind when you're doing that. And that is one of the things that will keep you from making mistakes when you start in the beginning. Pregnancy, again, going back to that, is a huge, huge one. So getting started at the beginning and looking at those chapter notes is really going to help you kind of avoid a lot of those things. There's times when pregnant mothers will come in and they have different conditions, and just depending on what it is, it could be that they have an injury, right? So there's a pregnancy code for injury, and then you code the injury codes after it. So that is something that you have to practice on if that is something that is not familiar to you. And the great thing about starting in medical coding, if you get assigned to a clinic, right, is that you get to study that clinic in specifics. Like if your first time in coding is in podiatry, you would be able to look up anything about podiatry. You can actually read the section for the musculoskeletal section that is more common to some of the conditions of the feet. like with the bones or even with the skin, and then you can look those up in your diagnosis book and see, is there anything that you need to know? Okay, so that'll kind of help you to, again, not make the same mistakes like I did and not use those combination codes, because you'll see those throughout any specialty, especially with diabetics, right? Because diabetics will have like those foot conditions, and if they have that, you're going to use a combination code. Okay, so that is one of the things that I would say. The other thing is, hi NC. The other thing would be when you're looking at the note. Okay, this is a big one, huge. When you're looking at the note, and sometimes the doctor will pre-select the diagnosis codes that they think apply to this encounter. So that is a staple with the electronic medical records. They will have the doctor say, okay, what did you treat? And this is going to calculate the level for them, and then it's going to go to the coder. The coder's going to review. Sometimes coders have, especially brand new coders, think that, okay, this is the code that the doctor wanted, and it sounds like a specific code, so I'm going to leave this one in here because that's what they wanted. They wanted this level, and I'm going to go ahead and push it through. It doesn't work that way, guys. If the code is not supported by the documentation, then you have to update the code. That is what we do. That is our job as medical coders. Now, if you see a doctor is selecting a code that they seem to gravitate towards, let's just say it is for fall, okay? And they just say the patient fell, okay? Well, there's an unspecified fall code, right? But let's just say the doctor likes to select fall due to a slip and fall and striking an object, right? I know I kind of said that backwards, but there's a code that specifically says that. But according to the documentation, it just says that they fell. It didn't say that they struck anything. It didn't say they slipped and fell on anything. It just says they fell. So if the doctor is selecting this diagnosis, this very specific diagnosis, then, that is something that they selected it. It doesn't necessarily warrant a query because they have it documented that the patient fell. But that might be something that you can talk about if they're wanting to get better with their diagnosis code selections or even their procedure code selections. Because sometimes they will put the closest thing that they think of, and then it's up to you to update it. So then you can talk to them and say, well, if the patient fell and struck something, then that would be something that you can document. Because just selecting the diagnosis code without having it actually written out in the documentation is not supporting that diagnosis, okay? So hear what I said. If you are working in the electronic medical record and the provider selects a diagnosis but does not support it in the documentation, then absolutely, then you need to go ahead and send them a query and say, okay, there's no diagnosis here, and you're not allowed to just pick up whatever code they selected. It needs to be written out. I don't trust codes that are just selected and there's nothing to go along with it, because sometimes they will select a code and then they'll write their narrative next to it, but without stating that the problem. And the problem with this is, if a doctor is tired, or they're just going too fast, or maybe they're just going through and they're just doing it really quickly, they can accidentally select the wrong diagnosis code, and then you have nothing in this documentation to support it. And if you just push this on through, you're in the wrong, because the doctor is not the coder, you are. So you have to see what is there. And if what is there is completely different from what they have, then you need to update the code to accurately talk about what is in the note, okay? And if you need to send a query because it's not specified, then that is something different. Or if there's missing information, say for instance, it is a broken bone. We'll go with a broken wrist. Which wrist? You got two, right or left. And if the doctor doesn't say right or left, then you can query them, okay, which wrist is broken? Because sometimes they'll do that. They say a patient broke their right wrist, or not right wrist. Patient broke their wrist, set into a cast, and it just basically just really quickly through the documentation, and then that's it. Not giving any directionals at all, right? And just saying the wrist was viewed on the x-ray, and there is a clear fracture. Okay, again, which side is fractured? So that would be something that would definitely have to go back to the provider for a query, because they need to be clear about which side is fractured. And any other missing kind of diagnosis. I tend to gravitate towards talking about injuries and musculoskeletal conditions because I'm an orthopedic coder and it's what I do. So, but that being said, that is something that you guys need to really think about when you see these diagnosis codes that are already selected. You don't want to just go in blindly and accept those diagnosis codes and say, oh yeah, well, that's what the provider selected. What did you select? And the E&M level, you can't just take them at their word. If they say that they want a level 5, but their documentation only supports a 3, then they're getting a 3. It's just the opposite when they select a level 3, but their documentation supports a higher level like a 4 or a 5 in those instances, then by all means push that provider up to a 4 or a 5 depending on their documentation. So that is where your skills come into play as a medical coder. It is about reading the documentation and understanding and comprehending what is happening in this, and not just taking things at face value as far as like whatever they select. Okay, yeah, that sounds good. You can't do that, okay? And when you have displaced and non-displaced, right, in fractures, if you have displaced and non-displaced in fractures, if the provider does not specifically say that that fracture is non-displaced, you have to select displaced because that is the default. Now, if they say that the fracture is non-displaced, then by all means, go ahead and pick up the non-displaced fracture. But make sure that whatever the documentation says, that it supports the selection of that code. And don't take for granted that these words are they're there or they're not there. Okay, you have to really understand what's happening, because if the doctor says that this is a non-displaced fracture, but the documentation is saying that it's not specified in there, they need to be educated on the importance, because there are 2 different codes. You know, it's the same location, but there's 2 different codes. There's a displaced code and a non-displaced code. So if it's not specified, it's going to default to displaced. And if you want to get really clear documentation, really clean documentation, as far as like getting that documentation and getting those clean codes is basically what I mean. Not clean documentation, but clean codes that are showing that level of specificity, then that's what you really want to shoot for. But it takes time and it takes effort to work with these providers, but it also takes you looking at these notes and really kind of understanding what's happening with these notes. So exciting stuff, isn't it? Hi Ashley. Oh, and you're welcome. The other thing is when they're coding based on time, right? In the outpatient setting, when they're coding in the clinic and they're saying, okay, well, I spent 20 minutes with this patient, or let's just say 30 minutes with this patient, brand new patient, and they have to do a decision for surgery on that day, right? And they're going to take them to the OR the next day. But they said, I spent 30 minutes with this patient. We discussed this and we did this and we did this. And so they're basically thinking that they're going to get this level based on time. Well, that's that in the outpatient setting. Just for an example, 30 minutes is a 99203, okay? But let's hold on here, okay? You have a decision for surgery that's going to happen the next day, right? So that's decision for surgery. That's modifier 57 with that surgery happening the next day. That's a lot higher than a level 3. As long as your documentation supports, but if they're saying that they're doing decision for surgery, they're making that decision, that moves you up into that moderate category when you're looking at your E&M tool, right? And you're looking at your medical decision making and your table of risk and everything. That level 3 is going to be dwarfed, right? Because then you have decision for surgery. Okay, so that bumps you up to that moderate box. Now, whatever the condition is, maybe it's an injury, right, that's requiring that surgery. Okay, well now again, that supports a higher level. And just because they said they spent 30 minutes, well, their medical decision making is actually going to bump them up to that higher level. But again, understanding the documentation and not just taking it, oh yeah, I see that they did their time. Okay, good. I can give them a level 3. But if it's showing that they did decision for surgery on this injury, okay, now we have a higher level. Okay. So that is, it's better for the provider when you understand this. Okay. But now they may have a visit and it's a real straightforward visit and everything's supposed to be hunky-dory and good, but this patient will not stop asking questions, and the provider needs to talk to them more, or they have to go over more information. They have to review more of their things, and they have like all of this stuff that they have to decide, and it takes longer than like a 15-minute visit. Let's just say it went to 30 minutes. And so the provider does their synopsis of what happened during that visit. Why did that additional time need to take place? And it turns out that it's 30 minutes on an established patient. Well, now instead of getting a level 3, now they can be at a level 4, because even though when you look at it, it's in like a straightforward way, but because they had to do all this extra work and the time was spent longer with the patient, and they have their time statement in there that says they spent that 30 minutes with them, then by all means, absolutely, on an established patient, then that would be okay to select that level 4, because that the documentation supports a higher level based on time. Okay. If they didn't have that time and they just had what they did and it was just a real straightforward visit, then by all means, whatever the level meets, whether it meets a 2 or a 3, that is what they're going to get. But because they had that extra effort time in there, that would be what would bump their level. But it's about understanding those rules. And so I have left the update things about the E&M in the community tab. I probably have to look up that thing again and put it back in the community tab, or I'll put it in the Facebook page. I'm still working on putting content over there. So I'll look for that. If I don't get to it tonight, it'll probably be tomorrow that I'll put that on there. But that was just one of the other things that I think new coders need to know to keep from making those mistakes. Not knowing aftercare. Not understanding the aftercare process, right? The patient has the surgery for carpal tunnel. Some people think that it's orthopedic aftercare. Wrong, because carpal tunnel is it falls into the neurological category, right? Which is going to make it aftercare for a nervous system condition. So that is where the more specific things come into play. So you got to really look at what is happening. If they had a plastic surgery, you want to make sure that you're doing the correct aftercare. If they had a surgery for a fracture, you are never, ever, 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 ever going to use orthopedic aftercare on an injury. You are also never, ever going to code for those bandage changes and suture removals on injuries. Never, ever, ever, ever. Even if they don't have a surgery, and let's just say that, they had to have sutures and things like that, but they didn't have a surgery, they just had to stitch them up. Okay, again, you're going to report the injury code. You're never going to report suture removals. It drives me crazy when I see people try to do this. You can't do that, because according to the rules, it is expected that there's going to be suture removals and dressing changes when you're dealing with injuries, whether they have surgery or not. And when they're in that global period, understand what the global period is, guys. If you don't get what global period means, the Medicare Learning Network is out there for you. There is a whole global surgical packet, right? That it's downloadable, and it's got really good. It's got such a wonderful breakdown. I've used it so many times. It's got a breakdown of what the 0-day global period means, what the 10-day global period means, and what all is included, 90-day global period. And let's say, for instance, the patient had a toenail removal, okay? And then they come back 5 days later. Well, that toenail removal, the matrixectomy, I believe it is the one with a 10-day global period on it. So if the patient comes back in 5 days later, you're not going to pick up ingrown toenail, right? Or whatever toe condition that they had that surgery for, the matrixectomy for. you're not going to pick that up, right? You're going to pick up the aftercare following surgery for the skin and subcutaneous tissue, because that is what that would fall under, right? So that is knowing your aftercare codes and getting familiar with that Z code section, right? Your reasons for encounter and your history codes, knowing what those mean. Same thing when the patient has had cardiac stents, right? When they have a cardiac stent, that is important to know. If they've had a joint replaced, that is important to know. Those are extra codes that are covered in Z codes, and you do need to pay attention to those. If they impact the encounter, of course, you want to go ahead and make sure that you're picking those up. There's also like do not resuscitate codes. Those fall under that too. So you need to make sure that if you see that, that is very important that you pick that up. There's a lot of codes back there too that talk about like social economical status, right? And a lot of times these people that mine data are looking in certain sections of the US, and they're seeing what codes are being reported, and especially with something like that, because social determinants of health is what they call it. So they're looking for these diagnoses, and sometimes facilities don't put a lot of emphasis in selecting those codes, and they say, well, it's not that important, just get to the bulk of what is. If it is there and it's impacting the encounter, clearly you do need to pick it up, because it is important. And like for our soldiers and that kind of thing, what do you see there that they're coming in for? Or veterans, that is something that is also important. Knowing these things, because it could be somebody that is like for occupational injuries, right? Firefighters, and police and things like that. So those are things that you have to make sure that you're paying attention to when you're looking at and trying to capture all of this, these codes that you see throughout this documentation. But it's about getting sophisticated enough to look in your book. Just look at it, guys. You don't have to read the whole thing, but flip through that, flip through the tabular section. Look at all those notes, and that will help you when you're brand new. Because when you're brand new, trust me, I know it's a lot that's coming at you all at one time. But when you start getting familiar with this book and you start flipping to those sections that you're coding for with a lot of frequency, it makes it a lot better. You get a lot sharper. I am very sharp in ortho because that is what I code for primarily. But I have done almost every single specialty under the sun. So I can do a lot. There's not a lot that I haven't done yet. I've done pretty much almost everything except for like interventional radiology. I haven't done that. But other than that, you get familiar with that book and you're good. You're good to go. But yes, that's something that I would say when you're new, just because you're new and you get audits, and then don't automatically believe that you're doing this wrong because you're being told that you're doing it wrong. Okay, now be very careful when you hear me when I say this. The auditors are there to help you to say, okay, well, this is wrong, this is wrong. Hopefully, they're telling you how they got to their argument. You're not just going to say, okay, they marked me wrong. Okay, I'm wrong. Oh, I'm new and I don't really know. Look at what they're telling you. And if they're giving you their reference, then great. Because if it's a reputable resource, like a book, like a Merck manual or coding clinic or something like that, that is great. Because that is exactly what we need to have as something in solid proof. It's not just, I have the right answers.com. It's not something like that. It is something that we can use, right? But if they're saying, okay, no, it's this way because that's the way we do it, and they can't really tell you why, but you have a reference that you used, and even though you think, well, maybe I didn't understand what it was saying, show them your reference and say, okay, well, I coded it like this because I saw this, and this is what it is. So is this? Can you explain this to me? And then hopefully they'll be able to say, okay, well, yeah, or oh, maybe yeah, you got that right. So it is okay to ask questions, but don't get defensive. And okay, don't get it, don't don't get an inflated ego either when you get something right. Okay, you got lucky or you got it right. You know, that is one of the things that happens because auditors are not always right. So, but what I'm saying is be respectful to your auditor because they get yelled at all the time and they're always telling people that they're wrong. So naturally, people are going to get defensive with them. But if you are showing that you have that, okay, I want to learn spirit, all right, then you're like, okay, the auditor is going to know this, and they're going to say, okay, this person, and new people can breathe that new life into a veteran coder and say, okay, now I got to remember, I got to put on my thinking cap. It's not just these other veteran coders I've been working with. It's somebody new who's fresh on these guidelines. So they should be able to say, okay, well, here's why. Okay, ideally, in the ideal world, that's what happens. But just make sure that you are very respectful when you ask them, okay? Because remember, you are a brand new person who is going to be questioning somebody who has experience. And you don't want to be offensive, okay? So just make sure that when you ask them, that you are still assertive, but you're respectful at the same time, because there's no sense in being like, I'm sorry. And please don't do that. Guys, don't do that, because that is the worst habit you can start doing. It doesn't make you look polite. It makes you look meek. And in this industry, you can't do that, because not only are you going to have to work with your colleagues, your other fellow coders, but you're going to have to go up with these providers too. And the best time to train yourself is early. It is early in the game, not when you're years in like I did. Was I scared in the beginning? Oh, yes. But I knew nothing about professional development. And it wasn't until later, 6 years later, that I started learning how important professional development was. And then it's just like, oh, this is what I've been missing out on all these years. I would have been so much better if I would have known this before. So that's why I'm telling you guys, you got to get with that professional development, because it's only going to help you, and it's going to make things a lot easier when you do. Okay, don't be scared. Whatever you do, just don't be scared. It's going to be all right, but make sure you've been studying and you've been looking at this book. And even with the CPT manual, it's the same thing. Just looking and reviewing those notes that is in the CPT manual if you're on the outpatient side. If you're on the inpatient side, take a look at that ICD-10 PCS manual. I love the one from Optum 360. Again, not an ad. But I like that book. I've been spending a lot of time with that book lately. And trust me, I'm like, okay, I don't mind this. Before, those tables used to intimidate me. I would get intimidated by those tables. And it wasn't until I started working with these boot camps. I did a boot camp earlier this year, back in February, with HC Pro. Now, not an ad for HC Pro, but I do recommend them. However, if you're going to do a boot camp with HC Pro or anybody, make sure that you already know a little something about the subject before you try going into this boot camp, because it will send you screaming for the hills if you don't watch it. So take the time. Think about what you want. If you want to invest in these other programs like that, you know, these boot camps to kind of help you along. I like the way HC Pro did theirs, because it was really like, oh, okay, I get it. I did their CDI one too. Oh, trust me. That was not for the faint at heart. That was not a game. Woo! But it was a lot of fun. But anyway, working with those really helps too when you're studying. But like I said, getting back to that ICD-10 PCS book, it's a lot of fun, but it is intimidating if you don't study it. I'm just saying. Carissa, hey Blue, I hope you're doing well. I am, thank you. I just got a coding and billing position, and this week has been my first week. Congratulations. So far, I like the job, but it's more billing, which I don't prefer, but I take what I can. Good attitude. My manager is so strict. Oh no. And kind of disrespectful. Oh no. But I really want the experience. Have you been through this before? She gets very frustrated when I don't understand something. I hate PCS. Carissa. We are kindred spirits, are we not? I don't hate it now. Okay, I don't hate PCS now. I did in the beginning because it's really hard when you don't understand, right? And then again, going through HC Pro, not an ad, but HC Pro was really good at explaining this. And then cooking with grease. But that's another thing aside. This situation here. Okay. All right. let me think of how to say this. All right. I have had this before. The impatience, the being strict, the micromanaging. Whew! You want to talk about misery, micromanaging. I hated it. I hated being micromanaged, but I have been through this before. Here's the thing. Unfortunately, sometimes there's leaders like this, okay? Leaders like this. We don't know why they are able to get into these positions. That's number one, but that's off the table. But you have to remember something. Medical coding is a lot of self-driven determination. So there's a lot of times that you're not going to be able to go to your leaders and ask them for help. You should be able to. But there's a lot of times you're not going to be able to do that because of something like that, right? That impatience and that bad energy. And you don't want a bad taste with this, okay? But what I learned when I got that attitude, right? Which I never went to her when I had this situation myself. I never went to her for questions because I trained her. And I was a new coder at the time. But I trained her on how to code for the clinic that I was coding for, because she had to audit me. She had just been moved into the supervisor position. So I had to train her. But yeah, after that, resentment. But that's another story for another time. So what I have learned is you don't go to your leaders that are like that for anything at any time. Okay, unless you need to ask for leave or whatever, and that's a different situation. When it comes to the coding, if you don't understand something, you do need to find a mentor or somebody that can help you really quick. Because if you're going to her and she's losing her temper like that, it's going to make you feel bad. You're not going to be able to learn anything, and it's going to give you a bad taste for the field, because you're going to think that people are like this. And not all people are like this. I had a really good leader before I had that so-called leader. And the leader that I had before she was very strict. She used to be a drill sergeant, okay? Very strict, but one of the nicest women you'll ever meet. But when you meet her, you can be very intimidated, because again, she used to be a drill sergeant. And when she speaks, she has a real hard voice. So you could get intimidated by being around her. But the thing about her was, when she got to, you could go to her for anything. And I knew I could go to her for anything. If I had a question, if I couldn't work it out myself, I knew if I brought to her my references, that she would be, okay, well, no, actually it's because it's this way. And she would explain it. With the other lady that I had to train, oh no, she knows everything, you don't know anything. She's one of those. So the thing that I had to say was, okay, I'm never going to ask you for help. Never. I will never ask you for help. But that's okay, because it taught me to be more independent. And the way that you learn to be independent in this field is to get with your books, to look for your reliable resources like the coding clinic and reading those things. Because there's going to be things that you don't understand. And I've notoriously said on my channel, there's only one person that I will ask for help. And that's my friend Jessica. She used to be my supervisor before, the really good supervisor too. She was a really good supervisor. But I would ask her when I would get stuck. And I'll say, Jessica, I don't get this. And then she said, what do you got? I said, I don't even know how to word it. She goes, okay. She goes, well, what do you know? Okay, I know this. I have a theory of, and then she goes, okay, I got you. And that is how I work things out. Even now, still today, if I get stuck, there is literally no one that I can ask in my facility for help. And I'm being very honest when I say that. But I have my friend Jessica on speed dial. Hey girl, what you got? And same thing with her, with me. Hey, I have this ortho one. I can't stand ortho. Sit Don't worry about it. I got you. What you got? And I explained it to her. She's like, you know, it would have taken me forever to figure that out. But that's okay. I got your back, girl. But that's what you have to do. Unfortunately, that's the reality of the situation. And it goes back to what I said the other night is sometimes people are not going to be happy for you. Okay? Leaders like that, it literally suffocates our industry because there's a lot of people out there that are like that. I'm the supervisor. I know. No, you don't. If you're not humble enough to understand that there's going to be some times when you're wrong, you're in the wrong. But from that spawns really good coders that are going to learn and do things on their own and dive into the deep end of the pool and swim, baby, swim. Or it's going to do the opposite. I hate this. I don't ever want to do this again. I need to figure something else out. One or the other. Which one do you want to be? But for me, what I would do in that situation is I would keep applying. I know you want the experience, but I would keep applying. Because at the end of the day, that lady is never going to change. Now, it could be something that is, and I know it's probably not you. It's probably something with her. And that's what I learned from my Arbinger Institute training. Not an ad for Arbinger Institute, but they were the ones who helped me to understand when people are having an attitude with you right away, it has nothing to do with you. It has everything to do with their own response to whatever's going on or whatever's going on in their household and that kind of thing. So this woman, you never know. She could have been brought up in a time where nobody trained her. So she's doing the same thing to you. To me, I don't think that's right. But there are some people who think that way. Okay? So me personally, if you're asking me for my advice, didn't ask me for my advice, I'm going to give it to you anyway. Okay? I would keep applying other places because if you haven't been there that long, it would be just as much, it would be just the same as if you started somewhere else brand new. If you got that job, you can get another job. You can totally get another job. Completely. You did it once, you can do it again. Yes, micromanage for sure. And I can't stand that. That is one thing I cannot stand. And I have said that. When I left that lady and I went to the boss after that, I told her, I can't be micromanaged. Whatever you do, don't micromanage me. I can't. I said, I will be the best employee that you will ever have, but I cannot be micromanaged. She's like, are you serious? Like, did you say that? I said, yeah, because I've been micromanaged. And it literally drives me to the, up the wall. I can't stand it because I'm an adult. Don't treat me like I don't know what I'm doing. I know what I'm doing. And I can get a lot more done when I'm not being micromanaged. There are some people that need it as a necessity. You got to constantly stay on them. There are some people that are like that. But a good leader is going to know, okay, she's autonomous. I'm going to leave her alone. She can do whatever she needs to because that's how it is. At the end of the day, it's going to get done. And I'm going to leave them alone. Okay? But then again, there are some that you got to constantly stay on them because they need to be babysat. If you don't need to be babysat and you're being micromanaged, you know, you got to look for something else. Because that's what happened. That was ultimately what happened with me and the manager. I finally went to the chief. And this had been going on for 18 months. Oh yeah, I was not going to let her get rid of me. And that was my thing. I was being stubborn at the time too, because I was just like, do I let her? No, I'm not going to let her. I'm not going to let her get rid of me. Because I honestly started to think, was this the right field for me? Am I in the right thing? You know, should I go into real estate? Because I thought about that too. It's like, should I go into real estate? You know, what am I doing? You know, and I was going through my own things personally, and I was not wanting to make a decision that was going to affect the rest of my life. But I was also not going to let this woman run me off from a very good position. Not going to happen. And so, but 18 months later, I was like, no, I can't. I'm tired. I went to the chief. I called and I asked for a meeting, and she's like, okay, sit down. What's going on? And I told her all these things that she had been doing. I said, I cannot anymore. I said, so I don't know what to do. Either I got to put in my notice or I got to be put on somebody else's team. She's like, well, we have a new supervisor coming in. I said, great. She goes, okay, if I put you on her team, that means I'm never going to hear about this again, right? I go, I have never had a problem with a woman before in my life. No woman, had a very good relationship with my mother. I can be a good girlfriend. I can be a good friend to other women. I've never had a problem with a boss, with a friend, nothing. I don't know what this is. And she says, well, I'm going to put you with this new lady. But that's it, right? That's the end of the problem. So I said, hopefully. She goes, I said, I know sometimes it's better the devil you know, but not in this case. She goes, what does that mean? I said, staying with what is familiar, because I know all her tricks. Yes, that would probably, in some people's eyes, be like, okay, well, I know what I'm going to expect here. But for me, I was like, no, I will take my chances on whatever happens with this new lady. And so she's like, okay. And I have not had any problems since. So, Christopher, with leaders like that, who needs enemies? That's correct. Tangela, yes, some managers can be intimidating by the tone of their voice. Yes, they can. Hi, Floor. Thank you for the blue hearts. Christopher, I once had a supervisor that came across as intimidating. After I got to know him, I realized it was totally an act. And some people are like that. Crafts says, my current employer micromanages horrible for a call center. Oh, and that's a double whammy. Because like I said, I've worked in a call center before, not a fun time. And I had micromanagers there before too. Because the thing that they like to say, and I was literally at this call center for 1 month, right? And this, it was 2 of them. They would come in. They go, if you're not here at work on time, you're fired. If you take too long for your break, you're fired. If you are taking too many restroom breaks, you're fired. I'm like, you know what? Let me fire myself because I'm so tired of y'all. I couldn't take it. I was just like, really? But yeah. This is hence one of the reasons why I'm leaving. I got called into a meeting because I was away from my desk for 3 minutes. Are you serious? I was using the restroom and having issues with my asthma and using my inhaler. As a fellow asthma sufferer, I can totally understand that. And not only that, when you take in that, right? When you have your thing for that, for your asthma, you have the jitters for like an hour afterward, because it's just whatever you're breathing in, and it's just like, it's misery. And then you're trying to think and concentrate, and come on. Really, 3 minutes? Did they want you to make a puddle on the floor? I mean, I don't understand. Like, how do you not? You know what I'm saying? Like, I don't get it. Like, I could understand, like, if it was habitual and you were gone for long periods of time, I could get that. But really, 3 minutes? Wow. Wow. Yeah, and so sometimes people just get like a power trip when they go and they get into these managerial positions. And sometimes, like I said, it really has nothing to do with you. Sometimes it is what is going on in their own home. And sometimes if they feel out of control in their own home, they're going to come to work and control what they can, which is the employees. So they feel like, hey, I have the power to make this person's life miserable, or I have the power to make them feel nervous. So I'm going to do it because that's what I do. To me, I don't think that that's right. But again, and there, like I said, when I worked in that room with 20 women, if there was one woman who was determined to make things miserable, she tried. She did for a lot of women. That's when I started learning to do the headphones, and I'm ignoring all of y'all, and we're not doing this because no, this does not work for me. This isn't 8th grade, okay? This isn't 8th grade, and this is not the cafeteria, okay? This is work. So run along. Christopher, I work for a call center for a well-known lab company. I learn new things all the time, but sometimes the stress gets to me, and I totally get it, especially when you work at a call center. That the call center, people think that if you've never worked in a call center, you might think that a call center is easy. All you do is you're on the phone and you're talking to people. But you get upset people, you get weird people, you know, and you get people that are lonely and they just want to talk and they just talk and talk and talk. And people are brave when they're not in front of you, which makes it even worse. That's why social media is so hard on everybody, right? These kids, they have these social media things, and the kids can say anything that they want to without being actually there in person. And social media has really taken away a lot of the things that we used to be able to have, like social behaviors that were acceptable. And being on the phone, you don't have to look at this person. You can have whatever kind of attitude you want to, because they're going to take it and they're going to listen to you, because they can't hang up the phone, and they know you can't hang up the phone, which is the worst thing, because you start listening to all these horrible things that they're saying, and it's just stuff that you think about and it gets in your head. And working in a call center is really hard. That's why I just would rather not answer the phone rather than go through all of that, So, Tangela, right? I had a lead like that at my previous job. She micromanaged and was speaking negative of employees. And see, that's a miserable person. That's somebody that's miserable. And sometimes miserable people will be upfront that they're miserable like that. And other times it will be people who will seem to be the sweetest people on earth. So nice. I had a friend that way. I had a friend like that. Smiled to my face. We had holidays together. So sweet. Little did I know. The most horrible, backstabbing person I have ever met in my whole life, in front of my face. Smiling. We're besties. Yeah. Sometimes people will be the way that they are, and they will present themselves one way and act another behind your back. And that's why I've always said, if you're going to be a certain way, then you need to be honest with yourself and be honest with other people. The other people didn't do anything to you. Whatever you've got going on is what you've got going on, right? And just because you yell at somebody or try to make some comment on social media and you think it's going to make that person feel bad, well, if they have a thick skin, it's not going to affect them at all. But for other people, it could. Depending, words can hurt. Words are something that you remember. Sometimes you think about the things that you say and how you say them. And it's just like, okay. And for some people, it's all about them. So that's why I say you have to do things in a way that is going to be helpful, not just for you, but helpful for others that are around you. Everything that I do here on the channel is genuine. What I do at work, that's genuine too. When I sincerely do care about my providers and what happens to them and their welfare and well-being, that matters to me. And it shows. And they say it all the time. They say, well, Blue, it shows that you do care. Yeah. And the numbers reflect that as well, because I take the time to go through and I don't get aggravated with them as far as like, okay, they're not doing this, they're not doing that. And where the other coders would have just given up. Oh, no. If you leave here, you go somewhere else, you're not embarrassing me. You are going to learn whether you like it or not. We're going to do this. But, that is the thing. The way people live their lives, sometimes people have it in their head that they want to be mean. That's the way they are, and you'll come across that. But then you'll come across others that are just like, okay, you can do whatever you want to, but I'm going to live my life this way. I'm going to do whatever I want this way. And I'm going to genuinely care about others. So as many times as I've had hurtful things said to me, it's made me thicker. Thicker skin. Because it's just like, okay. But I'm going to continue to be the way that I am. I'm not going to let anybody change me. And for people that are miserable, I get away from them. Because like I said, I have that, I feel their energy. And I don't like feeling like how they feel, because they have the ability to just be able to sour everybody else around them. So no, no, we're not doing that. I would rather remove myself from that terrible energy. And does it make people like say, oh, well, what about that lady? Well, there's just a way of doing things in life where it's going to be better for you. And not having to deal with that stress is the first step. Okay. Knowing that you don't have to be friends with everybody. You don't have to listen to the busybody. You don't have to listen to the office gossip. You don't have to listen to the office one that talks about everybody, in a bad way. You don't have to listen to any of that. You don't have to be involved in any of that. And I'm not. At my work, oh no. The girl said, well, did you know that so-and-so? No. See you later, ladies. I don't have to listen to that. I don't sit there and try to get involved in that, because that's the worst thing that you can do, because then people start talking. And you don't have to tell anybody anything. Sometimes people will think, oh, well, people are going to be real excited for me if I pass this other certification, if I do this and if I do that. No, you're going to have people that will be like, oh, so-and-so thinks they know everything. And that's really not true. It's a personal thing that you're doing for yourself, not for everybody else. So you keep doing what you do for you so that you can get better, you can learn, and focus on why you're there. You're the most important people for you there, your providers. Because at the end of the day, that is why you're there. And for these micromanaging managers, this is why I say all the time, I hope that what my videos bring out in people is how to be a good leader. Because leadership doesn't necessarily mean that you have to be in a position of leadership. You can have leadership skills for yourself and still be able to have that. In my clinic, they know that with the coding, it goes through me. It goes through me. That is my leadership position there. Do I take it seriously? Oh, yeah. Are they the higher performing because of it? Oh, yes. Because that's what I do. That's what I choose. That's the kind of leader that I want to be. And somebody that actually does care and that will listen. And then they said it too. They're like, well, you listen. Yeah, I listen and I pay attention. When you think I'm not listening, oh, yeah, I'm listening. I'm listening. And I pay attention. And I see the changes in their documentation. And I see what they're doing. And I'm okay. But again, it's having that thought process like, okay, that made my life less stressful at work. When I said, okay, I can put these girls on the back burner because I don't need to have all these drama and everything like that with these girls. I don't need to have all this drama with the leadership either. I can focus on what is important. And that was literally what saved me during that manager time. Was focusing on those providers in the coding. That's what helped me. So I hope that's what will help you until you can get into a better situation. Carissa, it's sucky because she literally sits right behind me in the same office, and it's me and her. And there's another girl I can ask, and I love her. She's very patient and helpful to me. You give such great advice. Oh, thank you. But that does suck. Oh. Crafts says, I usually don't talk too much to people at any job I have had because I am just focused on doing my work. And there are some people like that. But I came from a fishbowl, a horrible little tin can room of 20 women. We were all in bullpens, and it was kind of hard not to talk to people, but now that I'm in the hospital and I have my own space, my own office, that has made it a lot easier. It does make it a lot easier when your environment is better, because if you have other people around you, you start to have those instances where there's going to be times when there's going to be friction, right? For lack of a better word. And you just have to kind of work with it that way, and I had a partner a few years ago. And it wasn't always the best working in the same office because you had a person who was constantly chewing gum, popping her mouth, like with the gum, when you're popping the gum. And we're in a small space, small office. And it wasn't that much room in there. And constantly on the phone, no consideration for me as a partner being in the same room. spraying down with perfume, nearly choking me with that perfume because I can't be around heavy perfume because of my asthma. It just triggers it. So that is something that like I had to learn and think about, like, okay, I got to be calm because I don't want to trigger my own asthma. Because for me, if it gets too stressful, my asthma starts getting triggered. And that's scary when you think about it, because that's your body's way of saying, hey, we need a timeout. But sometimes you go through those instances and it does change who you are a little bit. So that did make me a lot thicker skinned too, because at the time I used to think that, everybody was cool, right? But then you sort of grow from there and you're like, okay, now I'm starting to learn a little bit more. But yeah, that was my point on that one. So unfortunately, but I hope that it somehow, some way, we all improve as a society, as people getting into this field, that it's okay to cheer for others. It's okay to be an original. It's okay for us to ask each other questions, but then have that responsibility of being able to look up things on our own, but just talk to each other to share ideas. Hi, Misty. Thank you for the blue hearts. But yes, but yeah, that is my point for today. Some of the common mistakes that coders can make. And then the other mistake is thinking that your coworkers are your besties. That is one of the things that you learn. And for some people, they've learned the hard way. They've shared things. I've seen people, this happen to others, where they've shared about their personal life. And then they say, oh, well, you're so-and-so's husband and this and that and a third. And it's terrible, what they share and being upset with the other person. And so that's why I always tell people, you tell people things on a need to know basis. There's a lot of assumptions when people see me at work, and they would never know. They would never know a lot of these things. My coworkers don't know about my channel. Yeah, they don't know. The clinics, oh yeah, my clinic providers, they know. In my area, they know, yeah, but the coders don't know. And I never made an announcement, oh yeah, I have a YouTube channel. Never did that either. That's my business. It's my business. What I do on my own personal time is my business. And I have 14,000 plus of y'all. Just about. So, I'm getting there anyway. But I just hope that this message can make you think about what you share at work, and give you that motivation to look things up and get self-sufficient before you have to ask for help. But being open to ask for help, it's a balance. It's a very delicate balance. Yes. But all right. So is there any other comments? I hope that helps, Carissa. Gosh, I'm so sorry about that. I hope that you can find something else. But if you're going to be there for a while, I totally understand. But for me, what I would do is I would just like, okay, headphones. Unless they're going to complain about that, which that is ridiculous to complain about, But learn what you can and keep applying. At least that's just what I would say. And maybe it could be just temporary and there's something just going on at home and she's just that way right now, That could be it. Hopefully. Maybe she's always a nice lady. I don't know. But the one lady that I did, well, I will tell you all this story. So when I got here to this facility, one of the ladies did not like me. She did not like me right away because I got put in her clinic. She was the master of her clinic and she did not want me there. And she made it very clear she did not want me in there. Well, I'm going through a lot of things personally. Okay. I'm just trying to keep my head above water and go to work. This lady made it a point every day to be mean, to forget to tell me things, or to forget to leave the cabinet unlocked, right? Or leave the key where I could find it, so that I could get in there and get more work. She would leave and I would be out of work. I couldn't get anything else. And so that would impact me. And so she had her little sneaky ways of doing a lot of things. Terrible, terrible woman. Until finally I went to my boss, the one with a very intimidating voice, and I said, look, I'm going through a lot personally. I don't have patience anymore. I literally can't. I've been going through this for a couple months. I don't know what else to do. She's like, okay, well, I'll talk to her. Well, her talk to her was like, okay, I'm calling you both in. So she gets us both in there. She's like, you know what? I've been seeing these little ice things going on. She's called that ice. It was very cold, she said, between us. She said, Blue, I see that you talked to the other lady, but you two don't talk. She's like, I think you two need to talk. Well, of course, she's like, rah, rah. And so I'm like, and so she goes, okay, well, if you two can't get along, I'm writing you both up. And I looked at her like, wait a second. And then she goes, no. This is part of you all standards. You're supposed to be able to get along. And then she's like, I think if you two actually sat down and talked to each other, I think you'd find that you have a lot in common. And so we're both irritated because I'm irritated. Now, I'm going to hit a pause button on this. You have to remember that this lady knows how to deal with people. She knows what she was doing. She knew that if she would have just singled the other lady out and told her, hey, you need to start talking to Blue. You need to make sure that you are acting right because it's not right for you to treat her that way. She knew she would have given me a harder time. So she said, well, if I put them both in the same boat, then she's going to think, okay, it's not just me being singled out. Now we have to work together because we're both going to be in trouble. But she never had any intentions to do anything to me. It was to get the other lady in line, and she knew how to do it. So that was her plan. And it didn't click until after the fact. And so when we get out back to the desk, right? She said, I want to see y'all talking. So I put my headphones in and I start working because she put her headphones in. I was like, okay, two can play at this game. Let me work. So I'm working. No big deal. And I'm like, I don't need to talk to this witch at all, And so I'm like, and so then I feel my chair shake. And I turn around, I take my headphones out, and I just sit there. Because I had it with this lady. I'm like, I've had it with you, She's like, hey. I'm like, hello. She's like, look, I'm really sorry. Okay. For what? Well, I haven't been nice. Okay. Well, I got married. Cool, I heard. Congratulations. Best wishes. Yeah, he's a nice man. I've seen him. I know who he is. So then, the real story came out. Well, you know what you've been going through. And of course, if you watched my channel from the beginning, I lost my mom around this time. She lost her mother in the same way the year before. So what happened was, she said seeing me again going through that brought it back to her. And while she wasn't nice to me when I first got there because she wasn't excited that I was there, it was compounded when I lost my mom because I was just trying to keep it together. And she said she saw a lot of herself again going through that. That's what the boss meant. So she says, look, I am sorry. And I said, okay, thank you. I said, that makes a lot of sense now. She says, I can be mean, but I'm not really mean. And I said, I'll believe it when I see it. And then she goes, do you accept my apology? And I said, yeah. I mean, we can work together. I'm totally fine with that. So then after that, everything was great. Everything was really good. It was about a couple months later. She and the other girl actually got another job at the same hospital in another city. And so it was time to say goodbye. So I was like, oh, okay, see you around. So she works for the auditors that audit us, right? And so she came back into town and she had actually called me and she's like, hey, it's me. And I'm like, hey, what's up? And because I have no issue with her. I'm like, okay, hey, what's up? And then she's like, hey, do you want to go, have a drink and have some dinner? I'm like, no, that's okay. I have some stuff I got to do and I have an appointment anyway. She's like, okay, well, maybe next time. And so I was like, okay. I'm not having a drink with you. I'm not having a drink with you because we're okay. But, you know, it was so many things. And that she had made it so hard for so long that I was just like glad that we were okay. But then I could limit that time that we had around each other, you know. But we do still see each other at conference. We do still see each other from time to time when there's events. And so we will talk, you know, and catch up. And when I see her husband around, I still say hello to him. You know, he was a very nice man, you know. So, I mean, it's just one of those things that you learn in time. And she says, you know, if you would have told me that we would be like this, laughing and joking when we saw each other at conference, she's like, if you would have told me, I wouldn't have believed you. I said, neither would have I. So, you know, we actually gave each other a hug. We parted ways. It happens. It's weird, but it happens, you know. Carissa, she apologized to me before training me, saying, I'm sorry if I lose patience. I deal with chronic pain. I empathize with her, but at the same time, don't make me dread coming to work because you are suffering. Hey, Caitlin. Fake apologies, Flora. Yeah. Yeah, Misty. Yeah. It was a very weird time, I think, is the best way I can say it. But I look back at that time, right? I think, you know, the only thing that got me was the coding. I think that's why I have such a special thing with it, because it helped me during that time. And I literally dove into it after that, you know, and during that whole time with that lady and, you know, going through all that, I literally dove into the coding. And I was just like, okay, let me just go ahead and focus on this, because this I can read and focus on what I'm doing. I can forget about everything else I'm going through personally and all these other ladies around here. I can forget about that for a while and just focus on what I got. And it worked, you know. And then after 6 years in, then I was like, oh, now I get it. I get it now. I get it. It's a passion now. That's how you discover that. That's how you get it, because the light bulb will click. And it's like, when you can't wait to get back to work, when you can't wait, and you're just like, you're so ready to go in the morning, and you're there, and you're just like, hey guys, you know. Then you're just like, okay, now it's not work. This isn't work for me. This isn't work, going to work, right? And then coming here and having my time with you guys. It's not work. So, you know, sometimes you get lucky. You get lucky in that. But as far as that lady dealing with that, her chronic issue, come on, man. That's not a reason to take it out on people. There's times when, yeah, you go through things, but it doesn't mean you need to be cruel to other people. Because would you like it if somebody did that to you? No. You need to find ways of dealing with those things. You know, and that's not always easy, but people have their own burdens. Everybody has their own things that they're going through. Everybody. Doesn't matter who it is. And somebody could be the nicest person smiling at you, and you think that that person has no problems. But you never know, being there might be their escape. And that's why they're smiling. Because for a little while, they can have some joy. Work does not have to be, oh, this is work. It can be a passion, but you have to know how to look at it. And for that lady, oh, I'm using this issue because I got this. And while I understand, because it's not so fun when my knee wants to go give out on me. It's not fun, okay? And sometimes when it does, it's just like, but I'm not mean to people. I'm just hobbling around. But, you know, Misty, yes, it like it literally takes you away from your current situation and makes you focus on doing something that makes you feel happy. That's right. Caitlin, Blue, how long do you think a new coder should stay at her first coding job? I think, excuse me, I'm being impatient about my journey into this field. Zena, thank you. Okay, Caitlin, I'm trying to think back because I know you sent me a message about that. Here's the thing. Depending on your impatience, what is your impatience about? Is it about not being challenged? Is it about not, getting more money? Or is it, because if it's about the money thing, then if that's really a concern, then you should look for another position. If that is what you want, it doesn't matter how long you're there. You could be there for 3 weeks and that'll still be experience on your resume. Okay. But if it is just that you are not being challenged enough, and maybe you're just in an easy clinic and you really want to do something harder and they don't want to give you anything harder, well, then go and find another position. But the thing that I will caution you on, if you're considering going to another job, right? If you got to really think about why you don't like this, and don't let it be because you feel like you deserve way more than what you're getting. Okay. If what you're getting is reasonable, you need to be there, do your dues, take your time, learn, do what you need to do. If it is less than what is reasonable, what is considered reasonable, then yes, it is okay to start looking for another job. If you are not happy where you are, then look for another job. You don't have to leave that one before you get another one. Find another one, then leave. Okay. You don't want to leave, put yourself in a hurt. Okay. Don't do that. All right. And don't get impatient thinking that you are owed something when you're brand new. If you feel like you're doing a lot and you feel like they're giving you a lot of responsibility to do and not enough of a challenge or something like that, like you feel like they're doing a lot of things like giving you like a lot of the easy stuff and you're just sort of like pushing things through and it's not giving you that intellectual challenge that you want, then obviously go ahead, try to look for another job, but if it's that you're doing all these things and you're thinking that you deserve a huge raise, that's something that new coders kind of struggle with, because if you are being paid decently, then that is part of the learning ropes, right? If what you're getting is better than what you had, right? That's the key right there. If what you have now is better than what you had before you came in, then you need to take your time and not be impatient, because that's the worst thing that you can do. If you are trying to hop from job to job because you think you deserve way more, then what are you doing? You're never going to be satisfied. You need to take your time and learn. Okay. Hopefully. It's the money, but I do enjoy the company and the coding. I'm currently doing wound care in multiple settings, such as inpatient and outpatient, which I enjoy. Okay. Then if it's that, thanks Blue, that really helps. Again, if it's that, if what you're getting is better than what you had, then you need to stay there until you find something else that is going to pay you what you feel that you deserve. But if you think that you're going to get some ridiculously high salary, like a lot of these schools promise, right out of the gate, that happens when you become a veteran medical coder, then you gotta kind of have to take a step back and you have to get realistic. Okay? Take your skills, whatever you got now, get your resume together and start applying. If you really feel like this is not paying you what you deserve, then by all means go ahead. But what I'm telling you is, if you're having better than what you had from before, and you are not being realistic about as far as like what you should be getting paid, right? Because there's some people that think they should get $30 right out of the gate. Come on now. That's ridiculous. I don't think that that's you, but I'm just saying there are some people that think that right out of the gate. And that's what I'm telling you guys. Be reasonable and work your way up. You will get what the market says that a coder gets in your area in time. But again, make sure that it's reasonable. And if it's better, if you're doing better, then you're already doing better than you know. But if you want to apply for something else, a job that pays more money, then by all means, get your resume together and get to applying. Because as easily as you got that job, you can get another job. This is my advice anyway. So, but yeah, don't be impatient. If you know you're being impatient, then, you know, the thing that you have to practice on is that patience. It will come with time. It's not going to be right away. And if you feel like you're doing a lot of these things, that's all filler for your resume. It's just my advice. All right, guys. See, I think I've touched on a lot of mistakes that new medical coders make. No, I did have to take a pay cut for my last job, but I told myself this will be a stepping stone in the career I want to be in, and I really do enjoy coding, and I know this is the right path. Okay, well then in that case, then you do what you feel is appropriate. And if you feel like they're not paying you enough, then try to apply for another place that is going to pay more. Okay, not everybody pays the same, but you know, again, be reasonable with what you're asking for. And if you had to take a pay cut, again, sometimes you have to go a little bit backward to go forward. That's just my advice. Anyway. All right. On that note, I have a Facebook page. If you're just joining me, I have a Facebook page now for Medical Coding with Blue. I hope you follow me there. It is going to be a lot of just coding tips. I think next week I'm going to try to put out something about modifiers because somebody was asking me about modifiers yesterday. And so I think I'll just do some kind of random modifiers for a little while, a little modifier series. I do have videos on YouTube for modifiers where I break down and explain. They don't get a lot of views. I don't know why. I think I'm pretty charming when I do the teaching videos, but you know, to each his own, whatever, you know. But I will go ahead and put it on Facebook. Maybe reading it will help people rather than me sitting here and explaining it. I don't know. To me, it would be easier if somebody explained it, but whatever. So Facebook, Medical Coding with Blue on Facebook. Yay! Thank you, Fleur. Yay, Misty. Christopher, are coders usually exempt or non-exempt employees? Exempt as far as what? Non-exempt as far as what? Yes, modifiers. I did one about like modifier 25 and 50. Yes, that was the one. Yeah, they asked you about Maximus TC and 26. I'm gonna have nightmares about TC and 26. But yes, I remember that's what it was. But yes, Christopher. I'm waiting on Christopher now. And thank you for the blue hearts, Misty. Oh, you know, maybe I'll probably like list those videos too. Yeah. On the Facebook page. It was me. Okay. yeah, it was you. See, I didn't forget. But yeah, that's, you guys gotta let me know. I mean, you know, what it is that you want. But like I said, I did a video on 25. I've done 59. No, not 59. I did one on 57. Did I do that for Christmas in July? I wonder if I did that. Was it Christmas in July? No, that was the... that could totally be my idea. Don't steal my idea. But a modifier series for Christmas in July. And no, Christmas Vlogmas coming up. I had to, yeah, I did one on 57, 24, 58, 26. I've done 15 videos. Let's see, was it 15? No. Okay, some of this is Patreon. So 57, 24, 58, 26, 50, 25, 24, 57. And I did it twice. And some of the lowest views I've ever gotten, listen to this, 221, 349, 253, 199. And I put that out in 2019. Oh my goodness. And I did an examples one, of 25 modifier. Of course, 2 ungrateful people unliked it. So 486, that's not bad. So then I have 496. Okay. They got a little bit better with time. I think the newer videos is the one that got better because that was in 2020. But the best one was 26. It has 1,082 views, 71 likes. That's not bad. I might have to go back and look at that one. That's my best one. Everybody else is like 600 views for a 25 modifier one, 42 likes. That's cool. Maybe that's not that bad then. But maybe that's what I'll do for Vlogmas. Salaried or wage earners? Missy, thanks for everything you do for us. You truly a godsend to me. Thank you. And the medical coding field. People like you are rare. Aw, thank you. I appreciate you, Blue. Beautiful and amazing blessings to you. Thank you, and the same to you. And thank you for the blue hearts. Christopher, salaried or wage earners? Most of the time, medical coders are not salary. They are hourly employees, if that's what you mean. Unless they're doing like contract work. Sometimes they may find work as a contract coder and they get paid per chart. So that's like when you're like an independent contractor, you know? So is that kind of what you mean? Like if you work in a hospital or a doctor's office, like more often than not, you're an hourly employee. Typically it's like leadership that becomes salary employees. You're welcome, Misty. But yeah, does that answer your question? Thank you for the blue heart, Christopher. I guess that means yes. Does that answer your question? But yeah, maybe that'll be my idea because there's enough of those modifiers. That's 25 days of modifiers. I mean, I could do that. I kind of wanted it to be different from what I did before. I'm still trying to think of some things to do for Vlogmas. Vlogmas is going to be here before you know it. And it's a crazy time for Vlogmas. Because Christmas in July was crazy. I don't know what to tell you, Crystal. I don't know what to tell you. I did the specialties last year for the July one, and I think I did motivation for last year's Vlogmas. I'll have to think about that. Okay, good. I'm glad. All right. So with that said, I'm going to go ahead and wrap this one up because it has been a long chat. But I hope this has helped you guys, you know, and I hope that whatever situations you're going through as a brand new medical coder, that you take the time and you learn and you go through all those things. You have to crawl before you walk on a lot of those things. Make sure you get familiar with those books. You're not happy where you are, make sure that you're looking for another job, but keep your job until you get another one. Don't ever, you know, leave yourself in a wrong place, you know, where you're like hurting yourself as far as like not having a job and then still looking again. Don't do that. Rochelle, I literally believe if someone is talking about someone else, they will talk about you too. And I don't have time for any of it. Girlfriend, high five. Crystal, I want to work at home. So I can't get one without training in the office. So I can't get one without training in the office. Desiree, thank you. God bless and God bless you. Misty, Crystal, me either. I love to do inpatient, but I can take whatever I get starting out. That's the way that you have to be. I don't know what your situation is, Miss Crystal, but I have said many times, when you're a brand new medical coder, you need in-person training. And that's just to set yourself up for success. But on that note, I'm going to close this up because we can chat tomorrow. So I'm going to wrap this one up. If you haven't subscribed, please do. Like, share, and I will see y'all next time. Bye.